Hi, this is Dr. Kim. I'm an integrative and functional medicine physician, and this is the part 4 of functional medicine approaches to treating ADHD. I appreciate the questions being posed in our LDN support group because that really creates a wonderful opportunity for me to answer questions. And in doing so, I end up doing a lot of research and ADHD or the different components of ADHD has been a lot of a excellent learning experience for me as well. So part one talks about the mechanism of Ritalin, which is more of methylphenidate, which uses a modulation or rapid modulation of norepinephrine and dopamine. And we asked the question, is it possible that slower modulation, like Wellbutrin, um, is going to do the same thing? And the clinical studies say that because Wellbutrin also modulates slowly the dopamine and norepinephrine, it gets equivalent results to Ritalin without the stimulant side effect. And if there is a depression-related symptoms, anxiety-related symptoms, and addiction-related symptoms, Wellbutrin may be an excellent tool to consider. And then after that, the part two, we talked about the norepinephrine modulation angle. And for the norepinephrine modulation angle, there are agents that modulate serotonin and norepinephrine. We do know that serotonin or alone or SSRIs do not have a recognized role in treating ADHD, but norepinephrine and dopamine has a role. So the question is it possible if you stimulate norepinephrine, can you treat ADHD? And the answer to the question appears to be yes. Both duloxetine and venlafaxine, both of them appear to be able to treat ADHD. So the venlafaxine in the U.S., we call that an efflexor, and it is a useful tool. And duloxetine we do use for chronic pain as well. So if there are secondary issues regarding chronic pain or depression, anxiety, then I think these two, with ADHD, I think these may be not primary because they're not FDA approved use, but off-label use. And last time we talked about other mechanisms such as can you use endorphins? And I think I don't know. There was no studies on endorphins, but I do know that some few people with taking LDN feel that it can be helpful. So today we're going to talk about nutritional interventions and functional medicine interventions and whatnot. So functional medicine, the idea of functional medicine is root causes, and what I'm going to present to you is part 4, and I think I have to make a part 5 because I don't really agree that these ideas alone are adequate to treat ADHD effectively using functional medicine. So we look at nutritional interventions. We may do elimination diets and food sensitivities, and you've heard of the certain dyes being excluded from Secretary of Human Health Services, and that's reason is that some dyes can trigger ADHD in pediatric population and probably adult population as well. And there's a study that shows that the INCA study that shows 64% of children following a restricted elimination diet experience significant improvement in ADHD symptoms. So that can be found in the blog article that accompanies this video. And then the nutritional supplementation of omega-3 fatty acids, zinc, magnesium, vitamin D. There are all studies that show some benefits. Vitamin D is interesting because it appears to improve evening ADHD symptoms. And then low sugar whole food diets have been studied. 2019, they did a meta-analysis. That means that they looked at a whole bunch of studies and looking at nutrient poor high sugar diet increased ADHD risk, whereas Mediterranean style diets had protective effect. But there's also studies in animal studies that uses ketosis, which is low sugar, that is fat burning state that seems to have protective effect for ADHD. And I'll talk about this more tomorrow or the next, the part 5, which I didn't plan for, but I think it's a good thing to do. So the gut health, gut-brain axis, there's a randomized trial study that shows that early life supplementation with probiotic can reduce the risk of ADHD. And in this case, it's the Lactobacillus rhamnosus GG strain. And there's other gut healing protocols that we do use, and sleep optimization. 2019 meta-analysis found melatonin supplementation improved sleep onset and duration in children with ADHD, and that resulted in better daytime behavior. Physical activity and exercise boosts dopamine and norepinephrine as well as endorphins, and it appears to improve attention and executive function. 2015 randomized controlled study showed that 30 minutes of aerobic exercise 5 days a week significantly improved attention and impulse control in children with ADHD. And then other things are like stress reduction and mind-body therapies, and especially mindful-based stress reduction, or MBSR. 2018 review found MBSR, or mindfulness-based interventions, had moderate effect in reducing inattention and hyperactivity in children and adolescents. Environmental toxin reduction is another thing to consider, and 2016 review connected environmental toxin exposure with increased ADHD risk, suggesting reducing these exposures may improve outcome. And then personalized testing biomarkers. One example is low iron stores or ferritin is associated with worsened ADHD symptoms. And a 2014 randomized controlled trial found symptom improvement with iron supplementation in children with a low ferritin. So you don't just give it to anybody, but you have to document that they have low ferritin. Other evaluated markers include vitamin D, methylation factors like MTHFR, and heavy metal burden. So the other thing is that you have to understand that there's not a lot of research that looks like that has a very strong effect on these making a difference with ADHD. So then what you have to do is you have to layer the treatments, and in my opinion, it would make sense to go ahead and enhance all the neurotransmitters. And I'll talk about that tomorrow, because it's not a conventional functional medicine approach, but through this research and other techniques I've done, makes a lot of sense that we should go ahead and create healthiest brain possible. So and neurotransmitter as well. So that means serotonin, melatonin balance, as well as norepinephrine and dopamine, as well as endorphins. So if you have learned something, if you like this video, please give me a like and consider subscribing. Thank you.